Hey y'all, hey, Erica with TimetoShrink. It has been 28 weeks since I had vertical sleeve gastrectomy. 28 weeks, y'all. This year is flying by. 6 months plus. 6 months plus a week. Wow. Y'all, I had vertical sleeve gastrectomy on November 23rd, 2018 in Puerto Vallarta, Mexico with Dr. Hidalgo and the weight loss team. It was such a great experience. I recommend them to anyone and everyone. If y'all are looking into surgery in Mexico, totally check out Dr. Hidalgo in Puerto Vallarta. Not only are you in paradise for recovery, the hospital is state of the art. It is spotless. The team is amazing. Okay, so this time last year, May of last year, is when I started my journey. I weighed 270 pounds. I started eating keto at that point. By my surgery on November 23rd, 2018, I was 235 pounds. Today I am 190. So that's 78 pounds down in a year for me. It's been a year. 6 months since my surgery. 6 months since surgery, but it's been a year since I started this process, y'all. So 78 pounds in a year. I will take it gladly. If y'all are new to me, I would love for you to join us. Subscribe to my channel, hit that notification bell. I post weekly updates on my VSG, how everything's going, but I also post all things weight loss, keto. I do meal preps, I do grocery hauls, just kind of all over the place. A lot of what I eat in a day. So I would love for you to join us. So I went to my doctor for my 6-month follow-up. I use my primary care doctor, my internist, as my follow-up since I had surgery in Mexico. I had my 6-month appointment today, actually. No, yesterday. I had my 6-month appointment yesterday. We had all of my labs done a few days prior so that we could go over them yesterday. And all of my labs were just beautiful, y'all. Regular, mid-range normal. No low normals, nothing low, nothing high. Right in the middle, exactly where you want to be. I was super psyched. If you've watched me for very long, I've talked about my vitamin regimen, and I've talked about how I am using patch vitamins for multivitamin and iron. My last lab showed that my iron was relatively low, and I started these patch vitamins because I was throwing up any multivitamin that I took. They weren't sitting with me. I tried a bunch of different ones. I wasted a bunch of money. So finally I decided to try the patch, but I was quite nervous because you hear so many varied reviews on whether the patch works or not. Some surgeons say they don't think it works. I don't know if they have any research though. I haven't seen any research saying that it doesn't work or that they do really. Anyways, my patches seem to have worked. Everything was beautiful, and my protein levels were amazing. I'm getting plenty of protein. I was slightly worried about that because my protein is a little bit lower than what I had originally been told I should average. I'm supposed to get between 70 and 90, and I usually average more like 60. And there's a lot of controversy about how much protein a person should get. It's all over the place. But I will say that me getting an average of 60, sometimes I get 70 or 80 or 90, but I would guess I average between 60 and 70, and my protein levels looked perfect. They were not low normal, they were perfectly normal. So I was super excited to see that. As far as vitamins go, I think I'm just going to continue with the patches because they're easy, they're working, and then on the side, I do take fish oil. I do take vitamin D that has vitamin K in it for better absorption. I tend to really struggle with vitamin D, and since I've been taking these, I'm doing really well. Definitely take the fish oil. I don't eat enough fatty fish. Like, I'm not a salmon fan. I'm not like a roe fan. I don't get enough otherwise of my omega-3s and that fatty acid that is so important for brain health, especially. Health in general, brain health especially. So I definitely take fish oil, and I like to try and take a pretty high quality fish oil to make sure that I'm getting all the benefits of it. I also take Smarter Curcumin daily. I like the Smarter Curcumin because I have lots of issues with pain and inflammation, and it really helps my pain and inflammation. What else do I take? I also take Magnesium Malate. Magnesium Malate is one of the magnesiums that is the most easily absorbed by your body, and the average person needs at least 300 to 500 milligrams of magnesium per day, but because of my fibromyalgia and my chronic pain issues, I have been advised to try and take a higher amount of that. So I'm taking about 1,250 milligrams of magnesium malate daily. And I think that it can help with nerve pain. It can help with restless leg type issues. I have kind of just started taking that. I was taking Natural Calm a few nights, but not on a regular basis. So this is something new for me. I'm hoping that it will help with my restless legs, because I definitely have issues with that a lot of nights. And I get these really like shock type nerve pains in my feet, and especially at night, and it is wake you up, jump out of the bed type of pain. So I'm hoping that's going to help with that. I will report in on how that magnesium goes. If you are liking this video, I would love for you to hit that like button. It really does help get my videos out there and shown. I would absolutely appreciate it if you would just take 1 second and hit that like button. I have lost 23 pounds since my last visit with my doctor. I saw her 3 months ago. So at 3 months, I don't remember what the weight was, but from 3 months to 6 months, I've lost 23 pounds. And for a vertical sleeve gastrectomy or weight loss patient, that's not a ton, but I'm super, super happy with it. 78 pounds total in a year, 23 pounds in the last 3 months. I will take it, y'all. I'm super happy with it. I wore a bathing suit this month. At the weight loss surgery conference, I wore a bathing suit and didn't even wear a cover up. Like, I was not minding how I looked. And we've been going out on the lake a lot, and I feel so good in my bathing suit, and I feel so much more limber and able to do things. I put on a regular sized life vest. Last year I could barely get a 3X life vest on. I put a regular size life vest on. I went out on the water with my kids on the tube. I tried to do it last year, y'all, and it was so embarrassing. It was such a production trying to get from the boat to the tube and back. I was like a beached whale. I wish I had a picture to show you, but I'm definitely showing you now what it looked like this year, and then I was able to get out there and have fun with my kids and feel okay in a bathing suit. Such an NSV, y'all. One more thing about my labs, my A1C was 4, which is amazing, and I was super happy with that. That is your, if you don't know what an A1C is, it's just a little finger prick, or they could do it from a blood draw, but it kind of gives the average of what you've been looking like for your blood sugar over the last few months, and a 4 is very, very normal. I was really happy with that. I do struggle with PCOS. I am very insulin resistant. I have been keto for a year now, y'all, but I definitely have struggled with my blood sugars in the morning, sometimes hovering around 100. It could be the dawn effect. It could be cortisol being a little higher. There's a lot of issues that could show that. So I was glad to see that my A1C is normal. That makes me feel a whole lot better. You definitely don't want high blood sugar levels, because that means that your insulin levels are high. And if your insulin levels are high, that fat is locked in. Your fat cells are locked in, and they do not want to go anywhere. So if your insulin levels are low, then your fat cells will open, and that fat can be washed out as we lose weight, which is what we want, which is one of the main reasons that I am keto and low carb, because it definitely helps promote fat loss, and that's definitely what I'm going for. With all of my chronic health issues, I definitely struggle, big time struggle to lose weight. I'm a slow loser. If I even think about eating a wrong food, I will gain weight, and then I have to get it back off. My inflammation and cortisol can sometimes be up, and that can put on water weight in and of itself. So I definitely work on that. I have been doing really, really well with drinking my water and getting my Zip Fizz in. My Zip Fizz is important to me for my electrolytes. I have something called POTS, which if you are not hydrated or your electrolytes are not good, especially your sodium, I can get really dizzy. I can even pass out. I get heart palpitations. My heart speeds up super, super fast. I actually do have to take a cardiac medicine for my heart, but if my sodium is not good and my hydration is not good, all bets are off. I do not handle life without that. So the Zip Fizz is what I have found really works for me with that. I would like to get away from Zip Fizz because it does have some sucralose, which I don't love. I don't think it's super healthy for you, but I have not found a regimen that works better than Zip Fizz for me. I did order recently something called Keto Chow electrolytes, and I'm gonna try that. Those with a little just salt under. I always carry around a little thing of Malden sea salt. I was gonna show you, but I think it's in my purse. But it's this little container of sea salt. It's called Malden sea salt, and I have them stashed everywhere. If I feel a little bit dizzy or if I'm getting a little bit of a headache, I'll put some of those directly under my tongue. It dissolves and it works really, really fast to correct the problem. So I definitely keep those around. The only thing that happened at the doctor's appointment that I didn't love, but is something that is important and I need to do, is I did let her know that I am throwing up a decent amount. I throw up probably 3 times a week, sometimes 4 or 5, and that's not normal. I get, I guess, clumping where the food just sits right here and it will not go down, and I end up having to throw it up. So I am going to be going next week to a GI doctor, and I'm going to have an EGD. You know, the EGDs that we have before surgery to tell the tube that goes down your throat so they can look at your stomach and your esophagus and everything and make sure your tissue's healthy, see if you have any hiatal hernias, anything that they need to deal with during surgery. Well, I'll just have that test again, and they can look and see if I have something called a stricture. What a stricture is a tightening of that esophagus, a tightening of the esophagus or opening between the esophagus down into the stomach. If it gets a little tight, then food can clump or just sit there and you end up having to throw it up. Sometimes it doesn't matter how well I chew, it just ends up happening. This isn't something that should happen. It should not be occurring, and if it is, you need to tell your doctor, y'all, because throwing up often or heartburn that gets bad heartburn, both of those things do not need to be ignored. You need to tell your doctor, because you can develop ulcers that can even lead to esophageal cancers if you're repeatedly throwing up or repeatedly having heartburn. If you're having heartburn more than a couple times a week, it's a problem. It needs to be dealt with. If you're throwing up on a regular basis since your surgery, it's a problem and it needs to be dealt with. It's something they can deal with pretty easily. When they do the EGD, they can do a dilation, which basically just stretches that stricture out and makes the opening back to where it needs to be. It's a very, very simple procedure. They do it in just a few minutes in an EGD, and I probably should have told her about this before. I kind of just thought it wasn't that big a deal, and then I'm realizing it's not normal to throw up on a regular basis just because I had VSG. Many of you do not do that, and if you do, you need to be talking to your surgeon about it or your primary care doctor about it if that's who you follow up with. It's very, very important. So I'll let you know how that goes, but she was very, very concerned when I told her about that because, as I just said and as she said, all of that acid up in your esophagus on a regular basis can lead to esophageal cancer, and that is not a fun cancer, y'all. Not that any cancer is fun, but I've seen that as a nurse, and that is not a fun one. Okay, this video has gotten a little long. I just had a lot that I wanted to talk about, y'all. But things have gone really, really well overall for me this week. I guess I'd kind of just gotten used to throwing up, y'all, and that's not good. So I'm glad I talked to her about it. We also are going to try to back off some of my psych meds. I take a medication, a psychiatric medication, at a very high dose to keep me stable depression and anxiety wise, but its main side effect is weight gain, and when I started on it is when I gained a ton of weight, and she and I both think that part of my weight loss struggle is this pill. But it's very important to be stable mentally, right? We don't need a suicidal Erica or a crazy Erica. So we're gonna back off of it slowly. And if I'm not stable, then I'll just have to go back up on it, and we'll just have to know that that's just one more hurdle for me. That's one of the reasons I have vertical sleeve gastrectomy, because of all my illnesses and all the meds that I have to take. I just have huge hurdles in losing weight. Just doing keto was not really enough, and I really did think I'd have VSG and the weight would just fall off. I wasn't thinking completely clearly on that. It's not like all of my chronic illnesses and my meds went away when I had VSG. So that's part of why I'm a slow loser, but I don't care. As long as I'm losing, I've just really learned to relax into it and to trust the journey, y'all. And that's my biggest advice. I know y'all hear me talk about it all the time, but I just want to get this message across. I want y'all to just trust the journey. If you're making the next right choice, if you're making that next loving choice for yourself, don't worry about that scale. Don't worry that you're losing slower than other people. Don't compare. It's just not worth it. It's not worth it. Just trust the journey, trust your journey, and make that next right loving choice, and just relax into it and go with it. All right. Bye, y'all. I'll check in again soon.